Good afternoon. Today's date is March 19th, and we are here together to provide an update to our community and media partners related to the COVID-19 response in Buncombe County. With us today, we have Dr. Jennifer Mullendore, Buncombe County Medical Director and Interim Public Health Director. We have VIA's Chief Medical Officer, Dr. Craig Martin. Dan Leroy, President and CEO of United Way of Asheville, Buncombe. Fletcher Tove, Buncombe County Health and Human Services Public Health Preparedness Director. And also Chairman Brownie Newman. Please hold your questions until the end of the speaker's summary, and then we will take Q&A via the dial-in option on the conference call, or you can also text 828-775-1321, and we will try to address as many of your questions as possible. We will get started with an update from Dr. Mullendore.
Good afternoon. I'm Dr. Jennifer Mullendore, Interim Health Director for Buncombe County. At this time, there remains only one known case of COVID-19 associated with Buncombe County. However, the case count continues to increase across the state. As of 11 a.m. this morning, there are 97 cases of COVID-19 in North Carolina. We heard from Governor Cooper and North Carolina Department of Health and Human Services Secretary Mandy Cohen earlier this afternoon that the first documented, confirmed case of community transmission in North Carolina was identified in Wilson County. Community transmission means that the person did not travel to a highly impacted area and had no known contact to a case of COVID-19. At the start of this outbreak, as with any outbreak, our efforts focus on containment of disease. We want to know who has the illness and how they got it. We isolate those with illness and quarantine their close contacts. These efforts help delay the spread of infection and give us time to prepare for the next phase of response. Now that we know that we have community spread in the state, we need to continue our efforts to reduce the impact of infection on the general public and the healthcare system. As a state and a county, we have already put into place many actions as if we knew we already had community spread. We've reduced the size of mass gatherings and closed restaurants and bars to dine-in service. These efforts decrease the number of people who get sick at the same time so that we can avoid excessively burdening our healthcare providers and health systems. The goal of all of these efforts is to protect you, the public. As we continue into this phase of response, testing for people with mild illness will become less important. We continue to have testing sites today at UNC Asheville and Biltmore Church in Arden that will continue until 6 p.m. or until supplies last. These efforts over the past 2 days have led to a total of 246 specimens being collected, which are being sent for testing. In our county, over the last several days, we have tested over 500 people, both Buncombe County communicable disease staff as well as local healthcare providers and Mission Hospital have been involved in this testing. We expect that with this increase in testing, additional cases will be identified locally in the coming days. It is important for everyone to remember that most people who become ill with COVID-19 develop mild illness and are able to recover at home. Keeping ill people at home helps reduce the chance that people are exposed to illness. Preparing for community spread is why we have emphasized and continue to emphasize social distancing measures. We must all do our part. Our individual actions matter. If you are high risk, so over the age of 65, have an underlying health condition or a weak immune system, we ask that you stay home to the extent possible. We know that the changes to your daily life are demanding and may take a toll on your mental health. I will now turn it over to Dr. Craig Martin of VIA Health to share information about support systems that are available locally.
Thank you very much. I really appreciate being here to try to share the message of hope, and am appreciative of this partnership and the amount of patience, kindness, and compassion that has been displayed during a time of increasing anxiety. The recommendations you're hearing today are based on science. VIA Health is a publicly managed healthcare organization that serves 22 counties in western North Carolina. We serve people who have mental health, substance use disorders, and who are struggling or coping with intellectual and developmental disabilities. Our goal, of course, is to help everyone stay in recovery, particularly during a time of crisis. To assist in that, we have an access to care line where people can call if they need assistance with mental health or behavioral health care issues. They can call that number 24/7, and it's staffed with trained staff as well as licensed counselors. The number is 1-800-849-6127. Let me repeat that in case somebody wants to grab a pencil and write it down. Remember, telephonic communication with your healthcare provider is a great way to reach out these days. 1-800-849-6127. VIA Health manages Medicaid benefits, federal and state funding, as well as some county funding to help serve people in the best way that we possibly can. Our goals during this time of crisis are to make sure that those people who are currently being served continue to get served, although it may be in different ways. It may be by video camera, it may be by telephone, it may be standing 6 feet away from your caregiver, but we want to make sure because we understand the stress and the anxiety. Right now we have a lot of families that are spending more time together than they have. At first it may seem like a vacation, but over time, just like company after 3 days, it may be more stressful. So we want to do what we can, and we will be sharing on our website ideas and suggestions, as will other people here, to help us maintain safety and do well. So just to summarize, our goals are to make sure that people continue to have access to care. That can be done by a mobile crisis visit to somebody's home if needed, or by going to a walk-in center. There were some concerns about the safety of our walk-in center. It is safe and available for people. 356 at Baltimore is available for people who need that at Biltmore. We also want to make sure that we maintain our providers so they have the robust services necessary. We have over 100 people, 100 different providers and agencies in Buncombe County. So with that, let me say thank you very much. Our goal is to help preserve our higher level of healthcare needs, such as emergency departments and hospitals, for those who truly need that level of care. Without further delay, let me please introduce Dan Leroy, who is the President and CEO of United Way of Asheville, Buncombe.
Good afternoon. My name is Dan Leroy. I'm the President and CEO of United Way of Asheville and Buncombe County. We at United Way are very pleased to be able to partner with Buncombe County and with the Emergency Operations Center to support the local response to this crisis. Two things in particular that I'd like to highlight that our United Way is doing right now. Number one, we're focused on connecting people from throughout North Carolina to the resources they need to get through this crisis, both now and in the aftermath of this immediate outbreak through NC 211. And number two, we're working to connect local human service organizations to volunteers and to other resources that they need to support our community throughout this crisis. And that's our hands-on Asheville Buncombe Center. I'm going to talk about both of those things right now. NC 211 is an information referral service that's operated by United Way of North Carolina, where families and individuals can obtain free and confidential information on health and human service resources within their community 24 hours a day, 7 days a week, 365 days a year. We're available in most any language. All you need to do is dial 211 from any phone, and you will be connected with a trained resource specialist. I will say that because some areas right now are experiencing phone and fiber problems, I'm going to give you an alternative number as well, and that number is 888-892-1162. Again, that's 888-892-1162. But for the vast majority of people, you can simply dial 211. United Way of Asheville and Buncombe County houses one of two call centers in the state, 2 blocks from here on South French Broad. So our role, NC 211's role in this crisis, will be to direct people to the community resources that they need as a result of this crisis. This can include things like food distribution sites, drive-through testing locations, expansion or closures of community resources, and other health and human services in our community. Our team is also highly trained, and they're very good at helping folks to fact-check rumors that might be out there in our community during this crisis. They can help folks think through their options during these really stressful times. We've had a lot of experience with natural disasters during hurricanes like Matthew and Florence, and our folks are well prepared to help people during this crisis. For folks who are concerned about symptoms, they should call the state's coronavirus hotline directly, but our team can transfer them as appropriate, and that number is 866-462-3821. But again, our specialists can transfer folks. In addition to NC 211, our United Way is working really hard right now to serve as a centralized source of information about the larger social service landscape in our community, who is doing what, and where are the really critical gaps. Our priority right now is to fill in this picture. And so right now, our 211 call center is collecting updates, real-time updates from community services across Western North Carolina and adding this information to our database so it has the most up-to-date, accurate information available to our callers. So far, a lot of what we're hearing are needs related to food, childcare, and homelessness, but this is a rapidly evolving situation, and those needs are changing. Again, 211 is the best resource. In addition, our volunteer center, Hands-On Asheville Buncombe, is shifting its focus and will serve as a centralized hub for emerging volunteer opportunities related to the crisis. We're performing outreach now to local institutions and community groups to build out the database so that we really understand what are the most urgent needs for volunteers in our community. And we are also connecting folks who would like to volunteer to those needs. You can visit our website, handsonasheville.org. And again, that's handsonasheville.org, no punctuation. Finally, our community school staff are working very closely with staff and administrators from both Asheville City Schools and Buncombe County Schools, along with several community partners to identify the most urgent needs emerging from this crisis at our schools and working with our partners to develop strategies to meet those needs swiftly. You can visit our website for up-to-date information about all of these resources and how you can be involved. And that website is unitedwayabc.org. At this point, I will turn it over to Fletcher Tove for the next presentation.
Good afternoon. I'm Fletcher Tove, Buncombe County Public Health Emergency Preparedness Coordinator. As we discussed yesterday, we have been working to put together a local state of emergency supplemental declaration. The intent of this declaration is to decrease the risk of exposure and limit the spread of COVID-19 in Buncombe County through social distancing. Social distancing is a specific strategy proven by data to severely lessen the impact of high consequence pathogens by minimizing the opportunity for close contact encounters. The declaration achieves this goal by mandating the closure of specific businesses and entertainment venues and limiting public gatherings to no more than 10 people. This order applies to all of Buncombe County and its 6 municipalities and will go into effect at 5 p.m. today, Thursday, March 19th. This declaration applies to gyms, fitness centers, and exercise facilities, indoor pools, spas, movie theaters, live performance venues, and arcades. This declaration does not include grocery stores, pharmacies, convenience stores, hardware markets, gas stations, farmers markets, and food distribution sites selling prepared food. These are locations where the public are not generally in close contact with other patrons. Furthermore, the limitation on gatherings to 10 people does not include normal operations at medical facilities, airports, bus and train stations, shopping malls, office environments, factories, and child care centers. One important point to clarify is that this order is more restrictive than Governor Cooper's Executive Order 118 in regards to restaurant, bar, and brewery operations, and that it also limits outdoor dining to 10 people or less, regardless of available space. Buncombe County thanks you in advance for understanding that this declaration is imperative to protect our community's most vulnerable and prevent the spread of COVID-19. I will now turn it over to Chairman Newman for remarks in signing of the State of Emergency Supplemental Declaration.
Thank you. I'm not going to read the entire resolution, but I'm going to read kind of the main parts of it that'll be going into effect as just described by Fletcher Tove. One clarification is that we've been discussing at what time the order would go into effect. I think in the final version of this, we decided that it goes into effect immediately rather than at 5 o'clock this afternoon. So, all right, let me just read some of the key parts of the emergency order. Supplemental declaration of a local state of emergency. The following declaration is issued by Board of Commissioners of Buncombe County. Whereas in just over the past week, the state of North Carolina, through the office of the governor, Roy Cooper, has issued Executive Order number 116, titled Declaration of a State of Emergency to coordinate response and protective actions to prevent the spread of COVID-19. Executive Order number 117, prohibiting mass gatherings and directing the statewide closure of K through 12 public schools to limit the spread of COVID-19. And Executive Order 118, limiting operations of restaurants and bars, broadening unemployment insurance benefits in response to COVID-19. Whereas, given its specific knowledge of Buncombe County and to further safeguard its residents and community via social distancing, Buncombe County Public Health has determined that an imminent hazard exists and has issued guidance recommending the temporary closure of certain businesses in which members of the public may be in close contact with each other to slow the spread of COVID-19. Now, therefore, pursuant to the authority contained in Chapter 21, Buncombe County Code of Ordinances, in Article 1A of the North Carolina General Statutes, Chapter 166A, the Board of Commissioners do hereby declare and order the following: that no gatherings of 10 persons or more shall take place in Buncombe County, including its incorporated municipalities, during the term of this declaration of local state of emergency. That all gyms and fitness centers, indoor pools, spas, and exercise facilities, movie theaters, live performance venues, and arcades shall close for business. I'm sorry, for clarification, it is at 5 o'clock, Thursday, March 19th, 2020. For the avoidance of doubt, and consistent with Executive Orders 117 and 118, grocery stores, pharmacies, convenience stores, gas stations, and food distribution sites, to the extent that they sell or distribute prepared food, are exempt from the provisions of this declaration. Also, a gathering of persons does not include normal operations at airports, bus and train stations, medical facilities, shopping malls, and centers. It also does not include office environments, factories, and childcare centers. Further, food banks and other food distribution sites, farmers markets, retail and hardware operations, and rental centers in which the public are not generally in close contact with other patrons are exempt from this declaration. By and with the consent of the mayors of the municipalities within Buncombe County, this declaration of local state of emergency applies within the municipal limits of the city of Asheville, the town of Weaverville, the town of Woodfin, the town of Black Mountain, the town of Montreat, and the town of Biltmore Forest. This declaration of local state of emergency shall begin upon its adoption, though again, the requirement is going to affect at 5 o'clock this afternoon, and shall remain in effect until rescinded, adopted this 19th day of March 2020. And I'm going to go ahead and sign the order. All right, thank you very much.
Okay, at this point, we are opening it up to questions from our media partners. We have a call-in line set up. I will turn the volume up. I ask that anyone who is calling in to please, and not speaking, to please mute their phone. You can also text your questions to 828-775-1321. Thanks for your patience here. Okay. So we have a question from WLOS, Jennifer Emmert. Is there an update on whether City Transit will run buses?
Currently, City Transit will continue to operate. Bus stations and such were not covered specifically in this supplemental declaration. We are working closely with them to make sure they have the latest guidance from Buncombe County Public Health, the CDC, and the North Carolina Department of Health and Human Services. And we are ensuring that they're putting into effect best practices to maintain cleanliness and proper hygiene operations.
Fletch, you might stay up there. This one's for you. Okay, so we have a question about does this order include spas, beauty salons, and barbers?
Yes, as specified in the supplemental declaration, spas, beauty salons, and barbers are included.
Okay. What about people working at hotels and motels? Do we have an answer for that one?
The order does not, hotels are not required to close as a result of the order. Indoor pools are covered by it, so some of the hotels might have indoor pools, so they would be not open during the time of the order, but hotels per se are not closed by the order.
What about bowling centers?
So for a point of clarification, the bowling center would fall under the arcade part of the declaration. The intent here is to any setting where patrons would meet that close contact criteria, which is currently defined as being within 6 feet of another person for extended periods of time over 10 minutes, is what the intent here. We want to limit close contact through social distancing to stop the spread of COVID-19.
Oh, okay. This person. Okay. Let's see. I would like to know what measures are being taken to protect our recyclers and sanitation employees.
So because COVID-19 is transmitted predominantly by droplets, and again puts people who are at close contact within 6 feet for 10 minutes or longer, there typically should be no additional risk to solid waste or recycling workers.
Will 211 work on cell phones that do not have an 828 area code?
The answer is yes. 211 will work from any phone. The callers with an 828 area code normally are routed directly to our call center locally, but during this crisis, we're working with our partners in Durham to answer calls in the order that they're received. But regardless of your area code, 211 will work.
Thank you. Will schools be closed longer than 2 weeks?
The decision to close public schools was made pursuant to the executive order by the governor of North Carolina, so that decision will be made at a state level by the governor.
For VIA staff, what is being done to ensure the safety of mobile crisis workers to prevent infection to and from workers?
VIA has moved the majority of its staff to home-based work, but obviously there still is a need to have connections and face-to-face evaluations at time for certain people. We would be following the procedure similar to what people experience when they walk into the Buncombe County DSS office, in which they would be screened. So we would do a telephonic screening. If someone were sick, had been in contact with someone who was sick, or had an elevated temperature, we would figure another way, perhaps by video conferencing, to complete the evaluation.
Okay. So we're getting a lot of questions about spas, dog grooming shops, gyms. So here's what we will do to address these questions. We will follow up with an FAQ to address these specific questions about spas and gyms, and just to address a lot of these questions coming in. What advice do you have for people who think that they might have COVID-19 and need medical care?
So if someone has fever and cough or difficulty breathing, the first thing they should do is call their healthcare provider. If they don't have a healthcare provider, they can call an urgent care, or they can call their Buncombe County resident They can call our Buncombe County Communicable Disease staff at 828-250-5109. Again, as we transition into this different phase of response, the guidance is more likely to become, if you are just mildly ill, stay home. And if you become more ill, then reach out to your healthcare provider. But again, most people who become sick with COVID-19 develop only a mild illness and are able to recover at home.
When will we know when this order is lifted?
When it's determined to be the appropriate time to lift this declaration, we will also have a press briefing and a press release to make that very clear to the community.
Okay. All right. So I think the rest of these we plan to address with an FAQ, and let me check on the phone line here. Do we have any? Okay. Well. Sure.
Just one last clarification, since there are two pieces to the order. One is a general prohibition on public gatherings of more than 10 people. So that provision goes into effect immediately. The provision regarding specific businesses such as gymnasiums is the provision that goes into effect at 5 o'clock this afternoon.
We have a question about childcare centers too. Do they have a question?
Can I do my thing? I also wanted to pass on information about test results because our staff are getting a lot of calls. So if your test for COVID-19 was performed by a Buncombe County communicable disease nurse or at one of the Buncombe County community testing sites, we will notify you of your results. If your test was conducted at your physician's office, your healthcare provider's office, or an urgent care, Buncombe County communicable disease nurse will contact you if your test result comes back positive for COVID-19. But if your test result is negative, your healthcare provider or the urgent care provider would be the group that would notify you of your results. Please do not call Buncombe County Health and Human Services asking about your test result if we were not the entity that performed the testing.
So we have two more questions here. What will happen at a child care center when and if a child care worker tests positive?
If a case of COVID-19 is identified in a child attending a child care center or in a staff person working at a child care center, we will conduct a case investigation, and that child care facility would be closed for at least a couple of days as we performed that investigation.
Do we know any more details about pregnant women?
There is still a lot that we do not know about the virus that causes COVID-19. In terms of pregnant women, we do know that they are considered higher risk for influenza. And so the guidance is really that pregnant women should just take precautions to reduce their risk of exposure to COVID-19. So again, it's frequent hand washing, staying away from sick people, and just taking those extra steps to stay healthy.
Okay, so Okay, so I think we will conclude this afternoon's briefing. We have a lot of text questions that came in that are generally in the same theme, so we're going to work in the next couple of hours to address those and respond individually to your text, and then also we'll be developing some information to share with on our website at buncombecounty.org. And again, we encourage members of our community to visit buncombecounty.org for all COVID-19 related information in our community. That is where we will post information as soon as we are able to, with additional details about any new developments related to COVID-19. Thank you.